I see very, very nice things happen when women come in for cosmetic procedures. I've seen patients get off of antidepressants because they feel so good. I've seen women who've kind of stuck in a job they don't want. They have a procedure done, they get a little bit more self-confidence, they get the job they want, or they advance in their career. I've seen so many wonderful things happen. Usually we just hand a patient a mirror and we say, you know, tell me what you'd like to work on today.
I have some skin damage on both sides of my cheeks and some on my nose, and I also want to tighten my skin, especially my the under the chin. And I figured I could use some of these, you know, advanced, you know, technology that they have now to make people look prettier, younger, and more fulfilled.
I'm from the generation that used to use Bain de Soleil and suntan oil that was basically, you know, baby oil with iodine in it. And so you would get out there and you would bake, you know, and you would be like a crocodile. And all those years we were thinking the sun was so good for us. Well, guess what, folks? I'm not a surfer. The sun's not good for you. You know, there really isn't a Santa Claus.
The portrait plasma resurfacing technology has really dramatically changed my practice. It's given me what I've been looking for in the past several years of a non-invasive way of not only improving wrinkles and texture, but also tightening the skin. And I've had a lot of other technologies in the past, but this one really delivers what the patients are looking for.
You don't go under the knife anymore, and you can pull like the skin, make it tighter, and get rid of the lines and the darkness and the circles.
I was ready to go in to have the slicing here, where they slice in front of the ears and they slice behind and they lift the whole face, and to get this cut and lipoed out, and then to have the eyes cut, and then above the cut, and then they cut up here and they cut there, and then they just sort of lift the whole thing, you know. And I was ready for that, but I didn't have to go through all that, that's a big difference.
I was skeptical at first, just like most physicians are. You know, can this really do this? Is this really going to tighten skin, reduce wrinkles, get rid of sun damage? It sounds a little bit too good to be true. After seeing the results, I said, yeah, this definitely does what it's supposed to do. So I purchased one myself.
Growing up, they always had the bags under the eye, can you believe it or not, even at a young age, and just all that scaly look. At the end of the day, somebody will ask me, are you feeling all right? How long have you been up? And just questions like that, which bother me, because I'm thinking, do I look that bad?
Unfortunately, there's a lot of pressure, and women portray that to me all the time. They want to look good for the person they're with, or they are competing with younger women in the workforce, or they would like to be in a relationship and want to feel good about themselves. So in many different aspects, all different ages, we get that pressure, that societal pressure to look good. Several years ago, I would say maybe 5 or 6% of my patients were men. At this point, I would say about 15 to 20% of my patients are men.
Looking good for my business is a big thing. When I'm dealing with brides who are 20-something, they don't want to be looking to someone who's a floral designer, an event designer, or a wedding designer who could be their grandfather, you know, which in fact I could, but I don't want to look that way, you know, because then they're going to lose confidence in you.
The beauty of plasma resurfacing is that it gives you a very similar result without that long downtime. So for someone who took maybe 30, 40 days to recover from a CO2 resurfacing can now recover in about 6 or 7 days.
This has only been a month, and I was only inconvenienced, I would say, 5, 7 days max.
Yeah, it's not anything I consider extreme, but it's, you know, you definitely see improvement quickly without a lot of downtime or, you know, pain.
The treated skin stays on like a Band-Aid to actually help you recover faster. And there is no risk of that demarcation line or hypopigmentation that people used to get with the more aggressive resurfacings. A lot of patients will say, I've seen people who look like they had their face burned off, or their face was oozing and they spent a month recovering. And a lot of patients are describing older ways of resurfacing, such as CO2 resurfacing and some of the things they did a few decades ago. With plasma resurfacing, because the treated epidermis is staying on your skin, not only does it act as a band-aid, but it also acts as a natural barrier to infection. The wow effect continues to improve for several months, and then the collagen stimulation, your body continues to make new collagen. So a patient may look wonderful at 1 month, but they'll look even better at 3 months. They'll look even better at 6 months. I always tell people, plasma resurfacing doesn't stop the aging clock. It just rewinds it a little bit.
If you are over 45 and you are thinking of having anything done, get it done. Because if it's the difference between having this done and getting your lease renewed on your Lexus, trust me, you have to sit in your face 24/7.
Whatever, it takes to feel good about myself, not what other people think, but what makes me feel good.
Most women who come in and have procedures done similar to the procedure we're talking about tonight, they're so ecstatic with their results that regardless of what issue they have, there is something I can do to make them look better.